What if I told you that some of the very tests doctors recommend after age 70 might actually shorten your life instead of saving it? Sounds unbelievable, right? For decades, we've been told that prevention is the key to longevity, that the more we check, the more we scan, the more we probe, the safer we'll be. But new evidence shows something shocking. Certain medical tests can do more harm than good. Every year, millions of seniors walk into clinics thinking they're doing the right thing. They sign up for bone scans, colonoscopies, MRIs, stress tests, and even full body scans, all in the name of prevention. But here's the harsh reality. Up to 37% of these tests in older adults result in unnecessary treatments, painful side effects, or invasive procedures that don't improve health at all. And here's the kicker. Almost 99% of people over 70 don't even know this risk exists. They're not warned. It's not on billboards. It's not in glossy health magazines. And your doctor, he or she may be too focused on protocol to explain the dark side of over-testing. So today, we're going to peel back the curtain. I'm going to walk you through 5 common medical checkups that people over 70 should think twice about, backed by real research and real stories. These examples will change the way you look at so-called routine care. And stick with me until the end, because the #1 test on this list isn't just risky. It's been linked to as much as 5% of all cancers in the US. That's the same impact as alcohol. So, let's dive in, starting with the test that seems harmless, quick, and pain-free, but could be undermining your quality of life in ways you'd never expect. If you're over 70, there's a good chance your doctor has recommended a bone density scan, often called a DEXA scan. On the surface, it sounds like a no-brainer. It's painless, it's quick, no needles, no hospital gowns, just a snapshot of how strong your bones are. Who wouldn't want that peace of mind? But here's what almost no one tells you. After age 70, this test can cause more harm than good. Why? Because bone loss is a natural part of aging. Just like wrinkles or gray hair, thinner bones come with the territory. A DEXA scan, however, almost always flags these changes as abnormal, leading to a terrifying diagnosis, osteopenia or osteoporosis. And what happens next? A prescription. Doctors often rush to prescribe bisphosphonates, medications designed to strengthen bones. But these drugs come with a laundry list of side effects, some rare, some shockingly severe. Ever heard of jaw necrosis? That's when parts of the jawbone literally start to die. These drugs can also cause esophageal irritation, brittle fractures, and painful digestive problems. Now, here's the real kicker. Research shows these medications don't actually help seniors very much. One large study of more than 1,200 women over 70 found that bisphosphonates lowered fracture risk by just 0.3% over 5 years. That's almost nothing, and certainly not worth risking a collapsing jawbone. Take Rose, for example. She's a 76-year-old retired piano teacher. She was healthy, walked daily, no history of fractures. Her doctor recommended a DEXA scan, and sure enough, it showed osteopenia. Alarm bells went off, and she was prescribed alendronate. Within 3 months, she developed acid reflux so severe she had to stop playing piano. Worse, she began feeling pain in her jaw. By the time she came off the drug, weeks of her life had been stolen by side effects. So what worked for Rose? Lifestyle changes. She started vitamin D supplements, resistance band training, and a diet rich in calcium, sardines, leafy greens, yogurt. Within a year, she was back to performing concerts, stronger than ever, and not a single fracture in sight. In fact, a 2022 study in Osteoporosis International found that strength training, balance exercises, and proper nutrition reduce fractures by more than 20%. Compare that to 0.3% from drugs, and the truth is clear. Bottom line, if you're over 70 and haven't had fractures, a bone density scan may only create anxiety and lead to unnecessary treatment. Focus on lifestyle first. But if you think anxiety from a bone scan is bad, wait until you hear what happens when seniors are sent for brain scans. Memory slips are scary. You misplace your keys, you forget a friend's name, you worry, am I getting dementia? Doctors, trying to be thorough, often order an MRI of the brain. On the surface, it seems logical. But here's the hidden truth. In people over 70, MRIs usually don't reveal anything useful. In fact, they often do the opposite. A massive study published in Neurology Today in 2021 looked at over 3,000 MRI scans of seniors with mild memory complaints. 86% showed some sort of brain abnormality, white matter spots, small shrinkage, little scars. But here's the catch. Only 3% of those findings actually pointed to treatable problems. That means for the vast majority, the MRI only caused fear, confusion, and unnecessary procedures. Meet George, a 74-year-old retired engineer. Brilliant mind, active in his church, but he occasionally forgot names. His doctor sent him for an MRI, which showed white matter changes. The doctor explained they were not normal, and suddenly George was convinced he had dementia. The result? He stopped driving. He quit attending church. His anxiety skyrocketed. Months later, a proper cognitive screening test revealed he was completely normal for his age. The MRI had stolen his peace of mind for no reason. And it gets worse. About 12% of seniors with vague MRI findings undergo invasive procedures like spinal taps or brain biopsies, tests that carry serious risks and rarely provide answers. So what's a better option? For mild forgetfulness, start with a cognitive screening test, simple, paper-based, and far more reliable at detecting actual dementia. And even more powerful lifestyle choices, better sleep, staying hydrated, brain exercises like puzzles or learning new skills. Because here's the truth, an MRI can't cure forgetfulness, but healthy habits can sharpen memory. So, if the bone scan and the brain MRI are questionable, what about the heart? Surely a stress test is useful, right? Well, not exactly. The cardiac stress test is one of the most common checkups for seniors. You walk on a treadmill hooked up to monitors while doctors watch your heart's performance. The idea is to spot blocked arteries before they cause a heart attack. Sounds like smart prevention. But here's the danger. In seniors over 70, stress tests are notorious for false positives. Research shows the rate of false alarms can reach 40%. That means almost half the time, the test suggests heart disease when there isn't any. And what comes after a false alarm? More tests, more procedures, and sometimes major surgeries that were never needed in the first place. One landmark study in JAMA cardiology found that more than half of the stents placed after stress tests provided zero survival benefit. These patients went through catheterizations, angiograms, stent insertions, and came out with no improvement in quality of life. Instead, they faced higher risks of bleeding, kidney damage from dyes, and long hospital stays. Consider Raymond, a 75-year-old postman who walked several miles a day. During a checkup, he mentioned mild fatigue on hills. His doctor ordered a stress test, which came back inconclusive. That led to a catheterization and eventually a stent placement. The result, severe kidney complications from the contrast dye, a week-long hospital stay, and lingering fatigue because his heart wasn't the issue at all. He just needed more hydration and rest. So, what's safer for seniors without classic heart symptoms like chest pain or breathlessness? Better options include Asumpers, a resting EKG to check rhythm, a coronary calcium scan, low radiation and effective at spotting dangerous plaque. These provide clarity without the cascade of dangerous interventions. But if you thought stress tests were risky, the next test is one that almost everyone over 70 has been told to do. And it comes with a 10-to-1 harm to benefit ratio. The colonoscopy. It's become almost a rite of passage after 50. Doctors say it saves lives by catching cancer early. And it's true for younger adults, colonoscopy can be life-saving. But after age 70, and especially after 75, the story changes dramatically. The prep itself is brutal. Gallons of laxatives, dehydration, electrolyte imbalance. The sedation is risky for the brain. And the procedure, it carries risks of bleeding, tearing, and even heart rhythm changes. In fact, a massive 2019 study in JAMA Internal Medicine tracked over 1.3 million seniors. The results? For every 1,000 colonoscopies in patients over 75, only 2 lives were saved, but more than 20 people suffered major complications. That's a 10-to-1 risk to benefit ratio. Take Dana, a 73-year-old grandmother. Healthy, active, no symptoms. Her new doctor pushed for a colonoscopy. During the procedure, a small polyp was removed. That night, she collapsed in pain. Bowel perforation had occurred. 9 days in the hospital, 10 pounds lost. She never fully recovered. Here's the tragic part. Dana had already had 2 clear colonoscopies before. Repeating the test was unnecessary. So what's the smarter alternative? Stool-based tests. The FIT test, for example, is non-invasive, can be done at home, and effectively catches most concerning cases. No prep, no sedation, no hospital risks. The U.S. Preventive Services Task Force now recommends stopping routine colonoscopies at age 75 unless there's a strong reason. But many doctors still order them out of habit. So, if colonoscopies are risky, what could possibly be worse? Brace yourself, because the #1 test on this list is one that private clinics love to promote, and it may actually cause the very cancer it claims to prevent. Now we arrive at the most controversial test of all, the full-body CT scan, often marketed as the ultimate peace of mind package. These scans are heavily promoted in private clinics and executive health checkups. The sales pitch is simple. Wouldn't you want to catch cancer before it starts? But the truth? These scans are far from harmless. In fact, for adults over 70, they may be among the most dangerous medical fads of our time. Here's why. A full-body CT scan exposes you to massive doses of radiation. One scan delivers the equivalent of 500 chest X-rays. And while radiation is sometimes necessary for specific medical issues, blasting the entire body when no symptoms are present is reckless. Even worse, research now shows these scans are contributing to the very disease they're supposed to prevent. A 2023 study published in JAMA Internal Medicine found that up to 5% of all cancers in the U.S. may be caused by unnecessary CT scans. That's the same cancer burden we see from alcohol. Imagine that. 1 in 20 cancers may have begun with a scan meant to prevent cancer, and the risks don't stop at radiation. CT scans often pick up tiny nodules, cysts, or calcium spots that are completely harmless. But once spotted, they set off alarm bells. Doctors order more scans, more biopsies, more surgeries. A simple benign spot suddenly becomes a medical odyssey. Take Marcus, an 80-year-old retired martial arts instructor. Fit, active, full of energy, he agreed to a full-body scan at a private clinic. The scan revealed a tiny 3 mm nodule in his lung, just a speck. But that discovery spiraled into months of testing, a PET scan, a needle biopsy, and eventually a collapsed lung. He was hospitalized for 2 months, and the result? The nodule was harmless all along. This is the hidden danger of full-body scans. They find things you were never supposed to know about, and once you know, you can't unknow. Fear takes over. Doctors feel pressured to act, and patients end up paying the price with procedures, pain, and sometimes life-altering complications. The American College of Radiology has been crystal clear. Full-body CT scans should not be used for routine screening in healthy adults. If you have symptoms like unexplained weight loss, coughing blood, or sudden swelling, then targeted imaging makes sense. But scanning the entire body just to be safe is like swinging a wrecking ball through your house to check for termites. The collateral damage is worse than the problem. So, what should seniors do instead? Focus on symptom-driven, targeted testing. If your body signals something unusual, investigate. But don't let fear push you into scans that can create more harm than healing. Now that we've covered the 5 tests, bone scans, brain MRIs, stress tests, colonoscopies, and full-body CTs, a clear pattern emerges. They are promoted as prevention. They feel responsible and proactive. But in older adults, they create cascades of unnecessary treatments. Why does this happen? Part of it is the culture of medicine. Doctors are trained to do something, patients expect answers, and tests feel like progress. But just because a machine finds something doesn't mean it matters. And just because a test exists doesn't mean it should be used. This is especially true after age 70. The body changes naturally. Bones thin. Brains shrink. Hearts slow down. The colon develops harmless polyps. Lungs grow benign nodules. These changes are normal, not dangerous. But when machines label them abnormal, seniors are pulled into endless cycles of anxiety, drugs, and surgery. In fact, one review of Medicare data found that seniors who underwent aggressive screening often had no survival advantage compared to those who skipped the tests. What they did have was more hospital stays, more complications, and more suffering. So the question isn't, should I test everything? The real question is, will this test change how I live or just make me afraid? So if these tests don't help, what does true prevention look like? The answer is simpler than most doctors admit. It's not hidden in machines. It's not wrapped up in expensive scans. It's in your daily habits. Movement, strength training, and balance exercises reduce fracture risk far more than bone drugs. Even light resistance bands can transform mobility and stability. Nutrition, whole foods rich in calcium, vitamin D, and antioxidants protect bones, muscles, and the brain. Sardines, leafy greens, nuts, berries, and beans pack a punch that no pill can match. Sleep, deep, restorative sleep, is one of the strongest protectors against memory decline and heart disease. Stress management, meditation, prayer, or simply spending time in nature lowers blood pressure and improves immune function. Connection, staying socially active, keeps the mind sharp and wards off depression, a factor that no scan can measure. True prevention isn't about finding every microscopic change in your body. It's about building resilience so your body can handle change when it comes. Let's revisit our 5 seniors. Rose, the piano teacher who ditched bone drugs and thrived with exercise and diet. George, the engineer who learned his abnormal brain MRI was just normal aging. Raymond, the postman whose false positive stress test nearly cost him his kidneys. Dana, the baker whose unnecessary colonoscopy left her hospitalized. Marcus, the martial arts instructor who suffered months of recovery after a useless full-body scan. Each of them walked into a clinic believing they were doing the right thing. Each trusted the promise of prevention. And each discovered that sometimes medicine overreaches. Their stories aren't warnings against doctors. They're reminders that we must ask better questions. Here are 5 questions to carry with you to every Dr. Sepp's visit. What's Sepp's the goal of this test? Will it change my treatment or just give me information? What are the risks? Radiation, sedation, complications, anxiety. Don't skip this part. What happens if the test finds something? Will it lead to surgery, more tests, drugs? Is there a safer alternative? Could a blood test, a stool test, or lifestyle changes do the job? What if we simply wait? Time itself is often the best diagnostic tool. Many harmless changes never progress. Asking these questions shifts the power back into your hands, because at the end of the day, your health isn't about how many scans you get. It's about how well you live. So, here's the truth. After 70, not every checkup is worth doing. In fact, some of them, bone scans, brain MRIs, stress tests, colonoscopies, and full-body CT scans, can leave you worse off than before. That doesn't mean medicine is bad. It doesn't mean doctors are wrong. It means that context matters. A test that saves lives at 50 can be harmful at 75. A scan that brings answers for the sick can bring fear for the healthy. The real secret to longevity isn't hidden in machines. It's written in your daily life. In the food you eat, the steps you take, the laughter you share, the rest you allow yourself, the choices you make. So the next time someone offers you a routine test, pause. Ask the right questions, and remember, sometimes the bravest choice is not to test, but to live. Now, I want to hear from you. Have you or a loved one ever had a test that caused more harm than good? Do you think doctors are recommending too many unnecessary checkups for seniors? Drop your thoughts in the comments. I read every single one and reply with personalized advice where I can. And if you found this eye-opening, give this video a thumbs up, share it with someone over 70, and subscribe for more life-changing health insights. Because prevention isn't about fear, it's about freedom, and your time, your energy, and your health are too precious to waste.